Every month, millions of women across the world brace themselves for a familiar discomfort, the pain that comes with menstruation. But have you ever wondered why some women can go through their periods with little more than a cramp, while others are curled up in bed missing work, school, or daily life? That's the puzzling world of menstrual pain, medically known as dysmenorrhea. For some, it's a dull ache. For others, it feels like a sharp knife twisting in the lower abdomen. But here's the thing. Painful periods are common, not normal when they disrupt your life. So what really causes this pain? During menstruation, the uterus contracts to shed its inner lining. These contractions are triggered by chemicals called prostaglandins. In women with higher levels of prostaglandins, the contractions become more intense, cutting off blood flow and oxygen to the muscle, resulting in pain. That's what we call primary dysmenorrhea, pain that is not due to an underlying disease but rather the natural process, exaggerated. But not all period pain is simple. Sometimes pain is a red flag for something deeper. Conditions like endometriosis, where uterine tissue grows outside the uterus, or adenomyosis, where it grows into the uterine wall, can cause secondary dysmenorrhea. Other causes include uterine fibroids, pelvic inflammatory disease, or cervical stenosis. Now, who's at higher risk? Young women, especially in their teens and early 20s, often experience stronger menstrual cramps. Having a family history of painful periods, starting menstruation before age 12, heavy bleeding, irregular cycles, or stress and anxiety can all worsen the experience. Even lack of physical activity and poor sleep may amplify menstrual discomfort. There's a common myth that painful periods are a sign of womanhood. No, they are not. Severe pain should never be normalized. Another myth says having a baby will cure menstrual pain. While pregnancy may change hormonal patterns temporarily, it is not a medical treatment, and certainly not a recommendation for managing cramps. So what can help? When it comes to prevention, regular exercise has been proven to reduce menstrual pain by improving blood flow and lowering stress hormones. A balanced diet rich in omega-3 fatty acids, magnesium, and vitamin B1 may help. Avoiding excess caffeine, salt, and alcohol before periods can also ease symptoms. For general treatment, the first-line option is usually non-steroidal anti-inflammatory drugs, or NSAIDs like ibuprofen or naproxen, which block prostaglandins. Starting them a day before bleeding starts can give the best relief. Some women also find comfort in heat pads, gentle yoga, or herbal teas. For ongoing or severe pain, hormonal contraceptives like birth control pills, patches, or hormonal IUDs are often prescribed to suppress ovulation and lighten menstruation. But here's the important part. If your pain is severe, long-lasting, or getting worse, it's time to see a doctor. Conditions like endometriosis are often underdiagnosed and may take years to be identified. Early diagnosis can prevent complications like infertility and chronic pelvic pain. Let me ask you this. Have you ever skipped school or work because of your period, or had to pretend you were okay when you were in pain? Share your story in the comments. It's time we stop hiding menstrual health behind whispers and start talking openly. If this video gave you new insights, don't forget to like, share, and subscribe for more powerful health content. Let's break the silence around women's health, one video at a time. Until next time, stay